This educational video was produced by the Department of Veterinary Public Health and Pharmacology of the Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. The main learning objective of this video would be to demonstrate different routes of drug administration in the dog, namely oral, intramuscular, subcutaneous and intravenous.
Hello everyone and welcome to the demonstration on routes of drug administration in dogs. So here we have Hamina with us to show you the routes of drug administration in dogs, and we are planning to discuss four main routes of drug administration in dogs, namely the subcutaneous route, the intramuscular route, the per oral or where you would administer drugs orally to dogs, and finally the intravenous drug administration and catheter placement. So let us first go for the subcutaneous drug administration route.
The most common sites of injection in the subcutaneous route would be the flank, scruff and the sides of the chest.
For that you will need sterile pair of gloves, and you will need an injection which is loaded with the required drug and the proper amount, and also cotton swabs with a disinfectant, most likely maybe 70% alcohol. And so we are going to administer subcutaneous drug in the subcutaneous route to Hamina. So Hamina is ready for her subcutaneous injection. The drug is loaded and Hamina is ready for her subcutaneous injection. Well, before we give the injection, I think proper restraining is needed. Well, for Hamina, I don't think you need that much of restraining, but indeed the handler will be helping me. And before we administer the drug, we would, as a procedure, we would just rub the ear so as to deviate the pain or whatever is going to, if there's any some sort of pain, it could deviate her attention from that site to ears. Well, we are going to administer the subcutaneous injection. For that you have to select a good site, especially the scruff of the neck is good. And well, before we inject the injection, it's always important to place it along the fold and not perpendicular to the fold. And we would scrub the particular area. And when we administer along the fold, make sure that you maintain a 45 degrees angle along with the surface of the body. Gently place it in. You pull the plunger back to see whether there's any blood, and then gently inject the drug. You can take it out, then give a good rub so the drug is properly absorbed. Well, now we would move to the intramuscular drug administration. Well, we have several sites that we would prefer. Well, usually we would go for the hamstrings, which are made of the biceps, semitendinosus, semimembranosus. You will find it here. And you have the quadriceps, just cranial to that, cranial to the femur. And you have the triceps in the forelimb. And also you have these lumbar muscles along the dorsum, the level of the lumbar vertebrae. Well, for Hamina, I would prefer going for the hamstrings, but you always have to be aware of the sciatic nerve that runs along, and you should be always vigilant to avoid that. So we're going to administer the drug. For that we have the injection which is loaded with the drug, and also once again we have a cotton swab that is soaked with 70% alcohol. Well, in terms of Hamina, we are having her on the left lateral recumbency, as you can see, and we've also placed a muzzle in case if there are any sudden reactions from Hamina, because there's a tendency that there could be some sort of pain that is elicited due to our injection. So as I said before, from the several sites that are available, I would prefer going for the hamstrings, you can easily palpate the hamstrings here. And it's very important that you have a firm grip on the muscle, because then you know that you are going to avoid the sciatic which runs over here, and this firm grip would be very important for you to administer the drug. So we're going to scrub this area using surgical spray. Then we're going to give the injection to the hamstrings, and it's always better to have it caudally directed. A bit of a reaction from Harmina. You gently pull the plunger back to see if there's any blood, and then slowly administer the drug. Cotton, place it here. Please draw the needle, give a gentle rub on it so the drug is properly distributed. So next we would be demonstrating to you how to place an IV catheter in a dog. Well, for that we would need an IV catheter of the appropriate gauge. Here we have a 22 gauge IV cannula, and also we have a cotton that is soaked with surgical spirit or 70% alcohol, an infusion set, and also a normal saline connected to it. So here we have the plasters that we would need to fix the IV cannula in the hand, and we usually have it's usually 6 inches long, and you can select a suitable width. And also it's important that you have a wedge-shaped area removed from the plaster, so it's easy to fix it on either side of the cannula that we're going to place these two plasters. So this is the way you would prepare the two plasters, and later this could be used to fix it in the hand of the dog. Well, Harmina is ready with the muscle for the IV catheter, and for IV catheter it's important that we restrain the patient well, because if it's not going to be proper restraining, placement of the IV catheter would be difficult. But Harmina is quite used to this position, so we're going to hold her like this. Well, just to let you know about the sites where you could place an IV catheter, we have the cephalic vein that runs along this radial ulnar position in the forearm, and also it could be given to the lateral saphenous, which is at the hindquarters. But at this today we are going to place an IV catheter to Harmina at the cephalic vein, and for that we will have to first shave it or clip it first. For that you can use a curved pair of scissors, or you could even use a electric hair clipper. So we've clipped this site with an electric hair clipper, and Harmina is ready for her IV catheter. Now if you could have a closer look, you could see we've arrested the vein proximal to the site where we are going to administer the IV catheter, place the IV catheter, and you can see the bulging of the cephalic vein over here. So that bulging of the cephalic vein facilitates us to place the IV catheter easily, and it makes the vein more prominent. So we're going to place the IV catheter. First we will have to surgically disinfect the site. If it's quite dirty, we could just rub it off with surgical spirit. You would first scrub once like this, and on either sides you would just scrub like this, just that. Then you're going to take the cannula, put the style and remove the covering. You can see blood has come to this site, which means we are inside the vein. And you slowly extend send the stylet forward, and you gently draw the cannula back. And you can apply some pressure so it will not be bleeding severely. You gently connect the infusion set here, and then you can see the cannula is in and fluid is going on. You can slowly place the plasters. So we're going to apply the plaster Well, first plaster should go over the plastic part of the cannula. So we're going to place the plaster first, like this, and it should go over the distal part of the forearm like this, around the hand. You should be very gentle, and it should be, you should have the plaster should have a firm gasp on the cannula. And there's another plaster that we would be applying underneath this part of the cannula. Just gently lift this up and take the plaster forward as much as possible. So we've placed the IV catheter to Harmina, and you can give whatever drugs you want, IV drugs. Harmina is ready for her treatments. Well, we're going to administer drugs intravenously, and for that we will need the drug and also a swab that is soaked with surgical spirit or 70% alcohol. The important thing about IV drug administration is that you avoid air bubbles in the syringe. So if you have air bubbles, there are few inside, as you can see. So you have to get rid of them. What you could do is you could just gently pull it down, give a nice tap to it, so we are getting rid of all the air bubbles, and then gently press it up, and you can see if you see you have to make sure that small bleb comes on the tip of the needle, so there's no air inside. So we're going to give the IV injection. So for that we would gently lift the arm, close the infusion set like this, then scrub it using the surgical cotton we have, and then place the needle at the hub, and then you have to pull the plunger back, so there's blood coming, it's definitely inside the vein. You can gently give the drug. Take it out, and then you would open. Now we're going to demonstrate to you how we are going to remove the infusion set from the cannula while keeping the cannula intact. It's a very simple process. We have the cannula cap attached to the cannula here. You just remove it first. Then you also have to turn off the infusion set. You just turn it like this, so there's no fluid flowing in. And then you can also apply some pressure in the proximal side of the cannula like this, so there's no considerable bleeding while we are removing this. Gently turn it like this, and then close it. And it's better if you could, if it's kind of a naughty one, you could always wrap a gauze bandage or a co-band around it, so she's not going to take it off with her mouth. So now we're going to flush a cannula. That is something, that is where you have to connect, that is something that you do before connecting an infusion set into a cannula that is already placed. So for that we will need a syringe, preferably a 5cc or 5 ml syringe with about 1 to 2 ml of saline. And then you remove the needle like this, and take off the cap off, and then you place it here and you suck out any clots that are inside cannula. So since there are no clots, you can always infuse it in. So now we know the path is quite clear. And then we remove the syringe, place the cannula, the infusion set, and open our drip set. Well, now we're going to administer a drug orally. Well, it's a tablet, and we'll see how we're going to administer this tablet to Harmina. Well, it's always important that you take a left hand and you can lift the maxilla, the upper palate like this. Then you can take your take the tablet to your right hand between your thumb and index finger. Gently shift it down and then close it down. And then you can rub the neck area like this. Sometimes for Hamina, you should always give a small blow to the nose like that, so she would definitely swallow it without throwing it up. Well, now we're going to administer another type of drug. Not necessarily a drug, it could be an antibiotic, which is a syrup, it could be a supplement. So this time it's just a B complex that we're going to administer to Hamina. It's a syrup this time, so it's in the liquid form, not in the solid or the tablet form. Well, for that it's quite easy if you could approach laterally. You don't go right from the center. You would simply try to lift the lip up, and then from the edge you could introduce the syrup. They would just take it in. But there's something important when you administer a syrup, especially, that there are chances of aspiration, which could be a mistake of improper drug administration. So basically, you should not be squirting the drug into the oral cavity or into the throat straight away, because that could simply cause an aspiration. So that's why we always use the lateral approach, and we would slowly administer drug into the oral cavity of the dog and not squirting into the throat.